If you're a human, you have a back. And if you have a back, that means you're probably going to have back pain at some point. At least 100 million people a year have pain, and we spend about 250 billion trying to treat that. And I wouldn't say we really do a very good job of it. And I think that's because we're not understanding properly what to do about it. I think we try to micromanage it. I think we try and look at it. We take MRIs, we take x-rays, and we're trying to see what's under there, what's under the hood that we can do something to. And I think that's kind of the wrong strategy. Kind of like a bird understanding the physics to fly. It doesn't really need to do that. It just needs to fly. And I think that's similar with treating our backs or really any injury at all. If you understand the nerve that's affected, or is it the facet joint or the disc, it doesn't really matter. You can even inject that thing. You can cut on it. Most people are still going to end up having pain. So I think there's a simpler way to manage it, and I think that doesn't involve micromanaging every little bit of medical intervention possible. I think we should actually flip it over and try to make it as simple as possible. Try to understand movement as a pattern. I always describe to patients, if you walk in the same spot in your grass all the time, you wear a path. You can kind of think of your joints that way. It's not that sitting is bad for you, or standing, or running. It's not that any of those things are necessarily harmful. It's having a lack of variability in those movements. So sitting, you can sit, it's good for you. Standing too long is not good for you. It's not better. Just because one extreme is bad doesn't mean the other extreme is better. We need variability. If you sit too long and your neck starts hurting, stand up. It's very often that simple. I think the problem is when we do things too much. It's kind of like we get ossified in those certain patterns. And so the problem arises when we either overuse it or when we lose the ability to move in the other direction. So if I sit all the time, I'm going to get a hunchback. And the problem is when I need to use the other direction, or when I need to get out of that pattern, and it breaks down. So as far as managing the problem, yes, you might have injured a disc or tweaked a muscle or whatever, but trying to solve that problem would be like if I had a foundation issue in my house and I tried fixing the drywall. That's not fixing the problem. What I tell people is you don't have a disc problem, your disc has a problem, and that's the pattern. And if we can fix that pattern, the disc can heal itself. If you keep trying to go at that disc and fix the disc without fixing the larger pattern that created that disc problem, you're just going to continue having problems. And you're just going to keep ramping up the intervention that's not going to work. It's going to be more expensive. You're making permanent changes that you can't undo. But if you'll take a step back, take a more global view, and understand the patterns that you're overusing, fix those patterns, most of the time, the thing that's hurting can heal. And you might not even need to understand what it is. It just fixes itself. And that's sort of the genius of our bodies and the genius of complex systems. So start being curious. Stop blunting your pain with injections or even ice, even though I do think those are beneficial in certain circumstances, or if you're in misery, you got to use those things. But long term, the only solution out of your pain is fixing the pattern.